Hello, everybody, and thank you so much to attend the replay of the lecture of Dr. Karim Rosero Martinez. We are here live from the Froggymouth studio in Paris, and we are so glad to do this lecture with you. The topic of this lecture is going to be very simple. The Froggymouth in adult orthodontic treatments. And for that, we have the perfect speaker with Dr. Rosero Martinez. She's doing functional orthodontics for 25 years now. She's having one fit in Colombia and one fit in Italy, being the founder of the orthodontic postgraduate program at the University of Valle in Colombia, but also teaching at the University of Ferrara in Italy. We are so glad to have you here. And Dr. Rosero Martinez, I leave you the floor to start your lecture. Thank you so much.
Thank you, Guillaume, for the introduction. Good evening, and now we are going to talk about the use of Froggymouth in adult patients. That is a really special for me for introduction, and now I want to share at the beginning this patient. And also she wasn't an adult patient. When I first saw her in 2018, she was the case, my first case with Froggymouth. Let me introduce myself. Briefly introduce myself. I'm from Colombia. When I did all my journey about my professional as a dentist and as a orthodontist specialization. And after that, I arrived in Italy. For 10 years, I worked in my private family clinic while also teaching. I was trained in a highly interdisciplinary environment where collaboration between dentists, speech therapists, physiotherapists, and otorino is the common way. This is my family, all my family, my sisters, my father and my mom, all work in the medical practice. That's why I totally believe that all the patients, for doing a perfect treatment, we consider the patient not just for our specialization, but for all the body and the psychological approach. All the specialists, the nutritionist, the doctor, the psychologist, the surgeon, the physiotherapist, all are important. The only thing we need is to understand the situation for treating the patient. This is my new life in Italy, where I live with my family. And this is the University of Ferrara, where I teach about the functional orthodontics. And the last year, I include in my presentation and my lessons the Froggymouth approach. But at the beginning, the Froggymouth is born from for children, for patients in a age so early age. But now we can see in my practice, I can see that I can use Froggymouth in adult patients because it's easier to arrive in a special environment in her on their mind. Here, that's why I have like an agent for talking about the Froggymouth in adult patients. We are going to talk about the impact of atypical swallowing on the orofacial structures in adults. Second, initial assessment of atypical swallowing, key evaluations, and observation. Third, my Froggymouth protocol in adult patients. And at the end, but more important, I'm going to share with you all my clinical cases, the success and failures. Okay, let's go inside. Let's talk about the impact of atypical swallowing on orofacial structures in adult patients. While early intervention in children is often easier to manage, the real challenge begins when these dysfunctions persist into adulthood. Many adult patients come us with complaints like back pain, oral breathing, low tone posture, the dentofacial deformity, sleep disorders, TNJ problem, poor body posture. I want to share with you this video of 3 minutes that we can see all the situation when we can ignore sometimes the function, the role of the tongue in all our body. Okay, let's go with the all evidence, scientific evidence. Many studies and articles that clearly demonstrate how an atypical swallowing pattern can significantly disrupt not only facial harmony and stability, but also affect many functions and like physiological and functional changes and tongue associated with aging. There are so many articles about this, but how about all the things we can do in the clinical moment when we have a patient in our study, in our office? We can see sometimes we see the tongue. The tongue has like these special impressions around in the lateral position of the tongue. And we always think that this is a problem about a macroglossia, and it's not always in that way. Canelas, in article, talk about this problem is atypical swallowing associated with relapse in orthodontic patients. This in the Journal of A.S.I.O. in 152 article. Why? We talk about this situation is with when we want, in adult patients, want to swallow with the all sucking all the structures, the muscles around the teeth, about the lips, and about the lateral function of the cheeks. That's why the tongue try to touch this position, muscle position, for being able to swallow. In this way, not always we have an open bite. Sometimes just this situation, clinical situation, show us that the problem is real and atypical swallowing. This is a picture that a tongue therapist shared with me about herself situation, about her tongue, the tongue tie. In these pictures, I can see, or you can see all the situation before, all this limited of the open, when she tried to open her mouth and try to touch with the tip of the tongue, the palate, is not able to open enough the mouth. After the intervention of surgical intervention, the frenulum, she can open the mouth more, and she try and she can the position of suction of the tongue around the palate. In this way, we are totally sure that is not able to touch the underneath of the occlusal surfaces of the teeth, and she has a really good swallowing, a nice swallowing, contracting all the occlusal surfaces of the teeth, and she can swallow in a adult swallowing and not an infant swallowing, the atypical swallowing. Okay, let's go and we can talk about the initial assessment of atypical swallowing, key evaluations, and observation. I will explain how I assess swallowing in new patients, what I observed during the first consultation, and which signs guide my diagnosis. I will explain how I assess swallowing in new patients, what I observe. Because it's important, this one, because when I observe problem with the pictures, with videos, I have to be well trained about all the clinical signs that show me that something is wrong in a normal situation and function in my patient. In this way, I can identify the problem, and I I can share with all my colleagues in different professionals, in different specialists for helping the patient in a good way. We can't try to correct the malocclusion on something that I have the specialist without thinking all the body of the patient, without thinking all the situation of the patient. That means that it's not enough to have imagine an X-ray for seeing for analyzing just the teeth, the mandible, the bones, but we had to try to go more inside, to try to see the space area for area, and we can analyze, we have be able to analyze the area if it's locked or not. And after that, not just the normal pictures, like intraoral pictures with occlusion and occlusal ones in an upper arch, lower arch. We had to see different pictures for helping us about the situation of the patient, like this one about in a position, different position with a little open the mouth for being able to see if the tongue is between the teeth or not. And the posture is important. We had to see, to analyze, to be able to analyze if the ears of the head of the patient is in the same position parallel to the shoulders. If the shoulder one is more up or lower, and just not for treating, just for knowing that the posture is not normal, and we had to ask to our physiotherapist or posturology, all the person we need, all the specialists, the professional we need for helping the patient in a really multidisciplinary approach. It's important and to see the biting, how the bite of the patient, the position, the normal function of the tongue, if the patient is able to maintain in a upper position the tongue when the mouth is open. If when she swallow all the position, if the lips are in a contract way, straightening the lips like this patient. Okay. After that, after presenting what I do during the initial visit, it's important to explain that this phase helps me not only to formulate a diagnosis, but to start building a proper treatment plan. That's why I have my protocol in adult patient, and I want to share with you. It's important to use all the things that the Froggymouth family share with us, with their client now. It's like the sizes, to know that there are different sizes, but the sizes is not really with the age of the patient, and we had to identify this situation. That's why we can use like a size for knowing that there is a part that we had to keep free of the contact of the Froggymouth in the mouth. Okay, and after that we can use the questionnaire. It's always with the Froggymouth for keeping the monitoring of all the phases of the patient before using Froggymouth. During using Froggymouth, for me, it's important after 1 month of using Froggymouth, but it's not for be sure that the Froggymouth is now in a good way, if it's in going in a correct, if it's correcting the position of the tongue. It's just for identify if something is not in a good way with the treatment, because sometimes it's not just to put the appliance in the position, the froggy mouth. It's not just that, it's to see if all the things about the position of the neck, about the position of the eyes, about the things the patient is doing during the use of froggy mouth. All these things are important. The patient is impossible. Sometimes ask to the patient, who the time 15 minutes, how can you control the time? Sometimes they answer to me, yes, no, during all the time, I'm trying to control the time with my watch. That means that their mind is always thinking about something different in a limbic way. That means that it's not working the froggy mouth therapy. In the first appointment, my protocol is this one. The first thing I do is record a swallowing video before using the froggy mouth, without the froggy mouth. After that, I prefer to do like a video in the first moment they use the froggy mouth. Unfortunately, in these pictures, in this video, I can show you the eyes because I had to keep the privacy of my patients. But the special thing I see and I can consider is the eyes is always trying to look around like a circle, because they are trying to control the swallowing without touching the lips, because the lips now are apart, are open, thanks to the froggy mouth appliance. That means that this is the first thing I can see. The swallowing is in an incorrect situation. That means atypical swallowing. I record the second video when, as I told you, and I provide written instruction and explain them in detail. Fill out the day one froggy mouth questionnaire with the patient, as I told you, and instruct the patient to report any difficulties immediately after day one. I schedule a follow-up appointment, as I told you, after 1 month to verify correct use and progress. And after that, in the second appointment, I mean, when after 1 month, I want to control the goal, identify incorrect habits, record again a swallowing video with froggy mouth, record a second video while the patient wears the froggy mouth. The first thing is without froggy mouth. When I record the swallowing video without froggy mouth, when you ask to the patient to swallow, remember that if in this moment the patient doesn't have enough saliva, the patient is going to try to look for the saliva between the cheeks, between the lips, and it's not the real situation. That's why I'll always give the patients water, a glass of water, to keep a little bit, not too much water. In this moment, I can record the swallowing situation because it's normal, and I can see if in this moment they are still using the lips for swallowing the water in this way. It's not the normal one, but it's the only way for controlling all the situations. After that, I describe in detail, I ask to the patient to describe me in detail the daily froggy mouth routine. When do you use it? What are you doing while you are using Froggymouth? How are you using Froggymouth? The time. Sometimes I ask for a little video with another person can do the video without her presence, the patient. And after that, schedule a second follow-up appointment after 2 months, and means 3 months all in total. This is the situation of video of the patient. You can see all the function of the lips when the patient this is the first one, and this after 1 month, they have still all the atypical swallowing. But I have patients in other places. I have patients outside Italy. This is a patient who lives in Miami, and she was showing me how she used the Froggymouth. And as you can see in this one, the patient used the Froggymouth in the wrong place, in a wrong position. And this is important because the shape of the Froggymouth is, if we have this little shape for the upper lips, is important. It's not able to keep this position. And if they don't show us these pictures, maybe the treatment is not going in a good way. The third appointment after 3-4 months, that means that this is the first goal, and I hope in this moment all the new position and all the new function of the tongue during the swallowing is in a good way. I record again a swallowing video without Froggymouth. I record the second video while the patient wears the Froggymouth. I schedule a follow-up appointment after 2 months to verify correct use of Froggy out the progress. I confirm that, please confirm that the patient has established a physical and physiological swallowing in a good way. Check for consistent dental occlusion during swallowing. And the only way is to ask the patient, try to touch the moment when they are with the posterior teeth in contact while they are swallowing. Okay, this is the patient, because sometimes they don't understand this situation. Assess the lip posture, tongue position, and nasal breathing. Reinforce long-term habits and close the Froggymouth protocol. When I say close the Froggymouth protocol, that means that I have to be sure that in this moment, the engram of the physiological swallowing is in a good way. What's the good way is swallowing. We can see the neck, the throat, when the patient do the swallow function without straightening the lips. After that, this another way I use, and is with one hand on the tongue, or try to swallow, ask to the patient to swallow with my fingers inside the cheek. In this moment, if you can see in this video, the patient moved my finger. That means that still using all the around muscles in the mouth for swallowing. That means that the atypical swallowing is still in function. And this one, another patient, you can see after 3 months, the movement of the neck during the swallowing, but without the movement of my finger. Okay. Now we can finally go inside the clinical cases, success and failures. I have so many cases. I have more or less 90 cases in this moment, but I try to show you the more typical cases with success and without failures, and with failures, excuse me, because it's important to have this situation to know that not always everything is okay, because in that way we can really learn about these difficult situations. Let's talk about the 9 success clinical cases. 2 young adults with 20 years old. And this is my first adult young patient, okay? You can see at the beginning of the use of the Froggymouth therapy, the position of the mandible, a prognatic mandible, and you can see the position of the tongue between the teeth, more in this side than the other one. And after using the Froggymouth therapy with orthodontic treatment, we can see that the tongue is totally inside and the profile of the patient is totally correcting. This is a patient with all her family with prognatic mandible. That's why it's not the first time I can see the patient, because this is the beginning of my patient. With this patient, I learn, and I'm totally sure you are going to learn too much about the situation of not consider in an early moment the position of the tongue. I started with the treatment with her siblings, all the family, sisters and brothers. They are 5. And she's the smaller one, the younger one. And this is the situation when she arrived. I say, please, when she's going to be 4 years old, please bring her here in my office for treating better than her sister and her brothers. And this is the situation at the beginning with 4 years old. I treated with orthopedic treatment, Frankel treatment, and with tongue therapist, with the logopedist. All the time, at 2 and 3 years later, that the situation with the tongue therapy and with the treatment of the appliance, orthopedic appliance. When I see this with all the tongue again still here between the teeth, I decided to include in another appliance all the grill for controlling the tongue. But we know, or maybe better, I know that this is just like something that is stop the function of the tongue, but not controlling the right position of the tongue. This is the first picture, intraoral picture photo of the situation of my patient. And we can see the intraoral photograph of the patient at age 4. The upper arch was narrow and the lower arch showed a pronounced open bite, especially at the level of the lower incisors. This is the situation 1 year later after the final treatment, when she was 9, 10 years old. Yes, now the open bite now is smaller, but still not perfect. She's still with tone therapy. She's still with the appliance for the night, for keeping all the results. And this is the situation at the end of this treatment. 2 years later after this one, I mean, she was 14. Always she goes to my office 1 year, yes, 1 year not, for keeping the situation, because all the family is a prognatic situation. I'm trying to keep the, anyway, genetic situation for keeping the results. But she stopped to go to my office for 3 years because she was starting to go to the high school. And she arrived after 3 years in this situation without appliance, without tone therapy. As you can see, the open bite is returning in this situation. But the situation was in 2018 when I was starting to use Froggymouth. And I say, okay, this is the moment to try to use not just the exercises, because she was an expert about all the logopedic exercises, but all the things was in a conscious situation. All the exercises with her mind trying to do it, but we are trying to introduce in the therapy something that is not to think in unconscious situation. And that's why I proposed her the Froggymouth device. She was my first adult patient, I was thinking in that moment, I was just starting to explore Froggymouth, and I hadn't taken any formal training yet, only online resources and basic information available on the internet. I was thinking if she was an adult, that means that I had to use the bigger Froggymouth device. It's not a good way because we are pressing a special junction between the lips that it's important to have in a free situation for a physiological function of the lips when the patient swallow. But anyway, I was trying to show you when she swallow, she's not using, because I can understand, because it's so big, the Froggymouth device. It's better smaller than bigger. This is the size L. That means that for her is the size M. Okay. And this is the pictures. This is the photo before Froggymouth therapy. As you can see, the position of the occlusal plane, okay? And this is the situation totally correct in the occlusal plane after 2 years of Froggymouth. It's important to show you that the malocclusion of the patient at the beginning was without crowding, just the problem of the occlusal plane. That's why I decided to leave the patient without retainer or aligner in the nighttime, and just with the Froggymouth once a week. This is the results, 2 years follow-up. As you can see, it's totally controlled, the situation of the patient. That's why I'm totally sure the relapse of all the orthodontic treatment, orthodontic treatment, is cause for an uncoordinated situation of the muscles for swallowing, for biting. This is my second patient, 2019. She was an open bite situation. I treated with aligners and Froggymouth. This is the beginning of her. As you can see, all the face is so long and with difficult for keeping in a relaxing way her face. This is the beginning. This is after just 6 months. As you can see in the picture of the smile, this is the situation at the beginning, and now it's in this way. So fast. Okay. As you can see in the X-ray, lateral X-ray, we can see that there is something that is not the permission for the right position of the tongue. Always something is in a forward position of the tongue, and you can see the open bite. This is the initial situation of the patient. This is now how is her swallow situation, the tongue. The same thing, the first patients with the size L. Anyway, this is different because we can see something free between the lips. It's better than the first one. And it's not contracting, it's not straightening the lips. Better. I don't know if you can see the difference between after, I think, 5 years of the end of the treatment. This is the beginning. As you can see, there is a space here and the open bite. And after follow up the 5 years, we can see this is totally closed without space, and the open bite is corrected. The inclination of the mandibular plane is totally different in a under closed wise. And how about the relapse? Dental relapse or incomplete orthodontic treatment due to an undiagnosed lingual restriction is extremely common. I frequently receive adult patients who have previously undergone orthodontic treatment. This is my patient at the beginning, before Froggymouth therapy, and this is the patient after Froggymouth therapy, because as you can see, with the retainer, fixed retainer, everything is perfect in the front, where is the retainer, lingual retainer. But what happened in the lateral position of the teeth? Totally close. That means that it's not enough to have the lingual retainer, fixed retainer, without thinking the position of the tongue during function, during the swallowing, and in the rest position as well. This is the situation of the patient at the end of the treatment in the facial position. As you can see, the occlusion plane is totally changed. This is a surgical patient with class 3 orthodontic situation, but he asked me, please, I can't go in surgery. I try to do everything for correcting at least a little bit my situation, because I'm a singer and I don't want to have this situation that is getting always worse. This is the beginning. I treated this patient with eyeliners and orthodontic treatment. And this is the end of the treatment, or after 12 months after using the aligners and Froggymouth, because you can see here, you can see the position of the tongue in a class 3 patient is always in a forward and low position. And it's impossible to try this situation without controlling the function of the tongue. But it's not enough with the therapy. We need something who help the patient to learn in an unconscious way the better situation, the position of the tongue. This is the beginning. As you can see, the cephalometric, all the position here, the position of the tongue. Let me show you now the position of the tongue. When I was trying to be sure that the tongue, the frenulum of the tongue was in a correct way before deciding to treat the patient with Froggymouth device. Okay. Let me show you I had to go, okay, in the first one. This is the size, the correct size for the Froggymouth. This is the patient with size M, because we are totally sure that the end of the junction of the lips are free. Okay. Let me show you, let's superimpose the two X-ray for showing you how the space air now is bigger and better. Okay. The last one was in a class 3 treatment, and this is the opposite in a class 2 treatment with a deep bite. The patient, always I see if something is in between in the space air, the tongue is forward. And we can see in this situation, we don't have an open bite, but we have something that is opposite of the rest position, the right rest position for the patient. The patient asked me, because she was going to my office, asking me, okay, my problem is my nose is too big for the rest of my face. It's possible to correct this one, the situation would to put in my upper front teeth backward. I say, no, the problem is not the upper teeth. The problem is the mandible. But you are an adult. It's not so easy to do it. You are a surgical patient. But as she asked me, okay, I'm trying to do it without surgical situation. The first thing I tried to do with her was to try to see the situation of the Froggymouth with the glutation, with the swallowing, the glutation. And you can see all the contraction and the sound. This is my patient at the beginning, before. This is my patient in the middle of the treatment, totally different, the shape of her face and her profile. This treatment, I do the treatment with orthodontic aligners without elastic, just distalization in the upper arch. always with the Froggymouth. And this is the follow-up of the patient before treatment, aligners with Froggymouth without elastic. This is the patient after 12 months. This is at the end of the treatment, 18th month, and this is the follow-up after 1 year of the end of the treatment. Still, the position of the mandible is more in the front forward, as you can see. It's not the same person, totally different. That's why now she say, okay, now you did my nose surgical situation, because now my proportion of my face are better. Let me show you the swallowing. This is at the beginning. Let me show again. Of course, this situation keep the mandible during all her life. The mandible was always in the backward position. And this is my patient swallowing without using her lips. Let me show you again. Exactly. And the X-ray, lateral X-ray. As you can see this space here that confirm me that the position of the tongue is totally forward, and this is without space, dark space, and the position of the mandible totally in the right position. This is at the beginning. Let me show you again. At the beginning, and this is after 12 months of the treatment. The midline totally correcting, just with the treatment of aligners and using the Froggymouth. Okay. This patient, she's 60 years old. And the problem of this patient was that she was so worried about all the parodontal situation of her lower teeth. Okay, let me show you all this situation. And I can't, and I couldn't start the orthodontic treatment with this situation, parodontal situation, on all the things about I can see that the problem is a interposition of the lower lip during the swallowing. This is the situation with CBCT. As you can see, nothing of bone in this alveolar bone in this place, but we can see totally the shape of the lower arch, even in the upper arch, showing me that something is pressing in front. Okay, this is my patient after the Froggymouth treatment. She started without orthodontic treatment. This is the beginning. Please look the lips. Okay. During the swallowing. This is during the first appointment with the Froggymouth device. Strengthening all the contraction of the muscles. And this is my patient after 60 days with Froggymouth, just Froggymouth therapy. She arrived in the office telling me, but I can't see anything. I think it's not working. And she was so surprised when I showed her the first video. Let me show you again. Okay. That means that in the patient, adult patient is easier to treat, to control the atypical swallowing. Okay, this is the digital models after treatment after 60 days, T0 and T1. Let me show you with the red point the distance. It's 60 days is really small time, but anyway, we can see the difference. Here are closer the lower incisors with the palatal surface of the upper incisors here and here. This is the red one at the beginning, and after almost 2 months, the position of the lower incisor with the palatal surface of the upper incisors. There is something special, and the situation, the parodontal situation in the same moment is totally, totally different, just with 60 days. This is another patient. As you can see, totally the situation of her lips with the froggy mouth, the first moment. All the movement, incorrect movement of the lips is, of course, the situation doesn't help for the situation, for the treatment, for all the following, the treatment is, I'm totally sure without controlling the swallowing, we can't go in a faster way and in a situation that we can avoid the relapse at the end of the treatment. This is the beginning of the treatment before, and this is the situation after 18 months. And you can see the face is totally different. It's more symmetric. And the smile is totally different. Okay, let me show you after 2 months with froggy mouth therapy. She say, okay, it's not, I know that it's not perfect, but it's totally, totally different and better. Okay, and now it's so important for me, all the opinion, to share with you all the things my patient say to me at the beginning or at the end or during the treatment, because they feel the difference. Let me show you what she said. Okay, and this is the last patient. She's a really special patient because her problem wasn't it's not the problem is not the teeth, the position of the teeth. She didn't ask me to align the teeth. They asked me, please help me to live without pain. It was so hard to me to hear this from a patient. And I say, okay, I'm trying to help you with my colleagues. My colleague was so worried about the position of the teeth without thinking to extract uh, premolars or distalize or something different. But I say, please look the tongue. She has a really big tongue, and I can't think to extract premolars because I'm going to create a smaller arch, but I'm not cutting the tongue. That means that it is going to be worse, the situation. Okay, this is the beginning. As you can see always in the X-ray, the space that confirmed to me that something is not in a good way and the position of the tongue is totally forward. This is my patient with the froggy mouth and the beginning of the treatment. Let me show you the face, the situation in a really stressed situation of all the face, the patient, and as you can see, after just 4 months, her face is totally different. I'm totally sure that without tongue therapy, without a froggy mouth device, these results in 4 months are impossible. Let me share with you all my patients said about her treatment. Okay. This is the same patient after at the final situation at the end of the treatment after 2 years of treatment without extraction, just helping her with the position of the tongue, the function of the tongue, and modifying all the wrong position of the teeth. As you can see, still here, her is there here, her third molar, but it's totally different, the position of the teeth, the front teeth. Is for showing you all all the movement, the functional movement in a right way after the treatment. Okay. And this is the beginning with the cephalometric or the lateral X-ray. And you can see all the space, this, or the airway. And this is at the end of the treatment. Totally, totally different in a good way. I'm totally sure that with distraction and without thinking in a swallowing, in a correct swallowing, the results totally is going to be relapsed. Here is totally stable. Let me show you the tongue at the beginning. You can see all the impression. See, we call this scallop, tongue scallop. At the beginning, so big, so hypotonic. In this way, her deglutition, the swallowing at the beginning. Let me show you. This is at the end. Sorry, this is at the beginning. X. I exchange the position. This is the beginning. Okay. And this is the end of the treatment. The lips totally relaxed. And how about the tongue at the end? Totally, totally different. The color, the size is totally, you can see it's not an hypotonic, it's alive, her tongue. And this is her opinion at the end of the treatment, because the other one was in the middle, that anyway, she was so happy. This is the end of the treatment. This is after 2 months, after the end of the treatment. I was asking her if the pain was still, and she said, no, nothing now. Okay, and how about failures cases? Why? Why, if I did a right diagnosis, if I did a really programmed treatment for correcting the malocclusion, even if I use the Froggymouth, the results they aren't in the right way. Why? Let me show you this situation. This is the patient with periodontal problem. This is my patient after 6 months. As you can see, anyway, after 6 months with Froggymouth, her face changed. All the wrinkles disappeared just with the treatment and the Froggymouth after 6 months. And what happened after that? This is the X-ray at the beginning. This is the X-ray 6 months later. What happened? I was trying to tell you that even the Froggymouth, the use of the Froggymouth is in a good way. Why sometimes it's not, we can keep this training in unconscious way, because I forgot to analyze something that I'm going to show you. Okay. This after Froggymouth therapy, but I totally ignore this situation. I don't know if you can see the part of the internal part of the lip, lower lip, in totally contact with the tip of the tongue, like in the same position, like a fusion between the lips, the internal lower lip, with the tip of the tongue here. And how about the frenulum? Totally short. And I forgot this part. This is my failure case. Now I asked her to do it, and she's not, she didn't want to do it. That means that the therapy is gonna be it's gonna be stable. She need to use the Froggymouth all the time, and she need to use all the time the retainers, because in another way, the relapse is totally guaranteed. In this picture, you can see better the situation. That means that is the only way she can use for swallowing. But the problem is the anatomical problem of the tongue. Even if I use the Froggymouth, we had to be able to identify. After that, we can send the patient to the right professional colleague. Okay, this is her, still with the atypical swallowing at the end of the treatment. Okay. This is another patient with relapse. even I use the Froggymouth. But in this case, this is a patient with class 3 malocclusion. She's an English teacher. This is the beginning of the treatment with a position edge to edge, the incisors, without overjet and overbite in the front of the teeth. Of course, because she is a prognatic mandible he has. And this is the cephalometric situation. We can see the class 3. This is the picture of the treatment after 12 months. We correct, if you can see in this one, the position of the teeth, we correct with orthodontic and with Froggymouth the situation, okay? But the problem is that the swallowing is totally corrected, the conscious swallowing, but the posture of the tongue in a rest position is like a bad habit, is always between the teeth. This is the beginning. This is her. At the end of the treatment, still, when she smiles, always the tongue between the teeth. That means that sometimes the Froggymouth for me is for the function of unconscious function of the swallowing, but the rest posture is totally necessary to complete the treatment in a multidisciplinary way. But she lives in Rome, I live in Ferrara, and she didn't want, she say, I don't have time, I'm totally happy with the results, but now she has a relapse. This is at the end of the treatment. This is her after 2 years with the mouth closed. Here is an opening. She's opening the mouth and is going to be, no, now it's a relapse, totally relapse in this situation. This is her with the, for me, so important, the video of the swallowing is totally important. Without that, I can't compare, I can't be able to follow all the treatment. This is her, and this is her. Okay, I show you this situation. And even the lips is in a contract way. And this is, as you can see, the lips in between the teeth. This situation is after 2 years of the end of the treatment. Is always in the same way. This is a failure, but it's important because I think with the failure cases with these cases, I learn more and more. This patient is, I use just the aligner treatment when she was 22 years old. Okay, this is the beginning with problem TNJ and a deep bite. You can see the S.P. curve totally altered. And this is the end of the treatment. The deep bite is slightly corrected, and the position of the occlusal plane and the position of the totally the S.P. curve is totally corrected after 1 year. This is the situation without Froggymouth, okay? But with the tongue tie treatment, surgical tongue tie treatment. This is the end of the treatment, and here she returned to me after, it was in 2020, after 5 years. Now the overbite is getting worse, as you can see in this way. This is at the beginning, at the end of the treatment, and she arrived in this way. You say 2021, 2021, and this is the situation 2025. You can see the overbite is getting worse. Okay? What happened? This is the situation, actual situation of my patient. The swallow, atypical swallowing. Okay. The first time with the Froggymouth. Okay. But please observe her tongue after tongue tie treatment. Still keep the tongue tie situation. Why? Maybe not perfect surgical treatment. Maybe the fact that all the tongue therapies, it wasn't enough at the beginning prior of the surgical treatment of the tongue tie. Sometimes the tongue, without thinking on the tongue, the relapse, the orthodontic, or even another treatment with the teeth, with the TMD, well, the TMJ, all these things maybe is going to be worse with relapse without thinking of the tongue position and the anatomy. The conclusion of these cases, because really the end of this situation of this webinar is for me is to realize about the important role, the important function of the tongue for all the treatment, for all the body. A malfunction in swallowing leads to major disorders, not only in the growth of facial bones, creating an insurmountable obstacle to their resolution through orthodontic treatments, but in adult patients is also the cause of many orthodontic relapses, failures in prosthetic, natological, periodontal, conservative, and endodontic therapies because it can alter the biomechanics. And balance function comes first. The success of any therapy begins with function and with trained healthcare professionals. The Froggymouth device helps the adult patient change unconsciously the way to swallow. The best orthodontic retainer and arch shaper is the muscular balance around the teeth, lips, tongue, and buccinator muscles. The Froggymouth can indirectly influence dental position, not by force, but helping unconsciously the function of the oral muscles. That's why the Froggymouth is a medical device, a tool, functional enhancer. The Froggymouth cannot be effective if the surrounding oral structures are anatomically compromised. My conclusion inside, don't know, please, is my role, my way. Don't ignore the tongue, its function and its posture, because the rest of the instruments depend on it. The perfect music, sound, harmonious and balanced. Now we have a way for controlling its function before and after our treatments for the stability with the help of the Froggymouth device. I'm going to leave you with this beautiful picture of three sisters. all of them are using Froggymouth, but just this is the picture their mother sent to me, and just one, number one, number two, number three, just one is using in the right, almost in the right position, the Froggymouth. She was totally sure about that everything was in a correct way. This is in the wrong way, up and down, in a wrong way. The position of the head is too low in this position, and this is almost the better way for using the Froggymouth. But sometimes if she didn't show me this picture, they think that everything is okay, and it's not, it's okay. Okay, please. You must be pay attention to everything, but everything is going to be easier with the good train of Froggymouth and everything on multidisciplinary way. Thanks to my family, live in Ferrara now, and thank you for this big opportunity for the patients, because I know that the time is so short for showing you all the situation I still learning about all the advantage of Froggymouth. Thank you. And now I'm ready for the questions.
Thank you so much, Dr. Rosero Martinez. It's always such a pleasure to attend your lecture, and we are having a lot of questions in the chat of people that are having few questions regarding the presentation you just made to us. The first one that is coming the most often in the chat is wondering, are the patients that you were presenting to us during the lecture are also doing myofunctional therapy with a myofunctional therapist or speech therapist together with the Froggymouth or not?
Yes, all the patients are using the adult patients. All the adult patients, they are keeping a tongue therapy, logopedic therapy, while before, during, and after treatment, not in the same intensity. At the beginning, more than at the end, with Froggymouth.
There is a second question that was coming 2 times on the chat about the right moment, the perfect moment to start the Froggymouth part of the treatment when you are using Froggymouth with an aligner orthodontic treatment. What is, according to you, this right moment? Is it before, during, or after the orthodontic aligner treatment?
Before, during, and after. With the same answer. At the beginning, I used Froggymouth for 1 month before the beginning of the treatment, orthodontic treatment. Okay, because in this way, the Froggymouth can help me to enhance, to get the speed of the treatment. Maybe is faster and easier with the use of the Froggymouth, because it's controlling all the muscles and controlling the pressure of the tongue. And during the treatment as well, at the end, it's just once a week for keeping, because for me, in this moment, if I'm totally sure that the swallowing is in a correct way, in an unconscious way, for me, the best retainer is the Froggymouth.
Okay, it's very interesting. So that's when you start the treatment with the Froggymouth. But when do you consider you may end it? What is the trigger that is giving you the indication that you can finally say to the patient, it's the moment for you to remove the Froggymouth?
Perfect question. Yes. The only way for knowing that is just with a clinical approach because I can use with TENS to measure all depression of the muscles. But for me, in my office, with the video, when I can speak, I can talk with my patient without constant situations. I mean, I'm talking about something different, always with the camera. And while the patient, she or he is talking to me, if I see that in the moment it's not using the lips for talking, for speaking, and it's always all the things without pressing the lips, I'm in that moment, I'm totally sure that the treatment is finished. The swallowing is correct. But anyway, I recommend to use the Froggymouth once a week in adult patients. In patients in an earlier age, children, I don't use just 3 months because always after 3-4 months is totally correct.
Great, very clear. One question that I know you spoke a little bit about that, but I wanted to come back on it because it's very, very important. Many people are asking you if you may re-explain a little bit how do you choose the right size of the Froggymouth? Even though it's not the biggest deal, it's always important for the audience to understand what are the little tricks that you are using to choose the right size.
Yes, this is so important because at the beginning I made a lot of mistake about the sizes. The sizes depend. I have like a special measure that you, Froggymouth family, give to us, and I need to be sure that with the different measure sizes, there is at least 2 millimeters free of the point, the junction of the lips. Just that. But really, it's better anyway with a smaller one. I can use it even in adult patients. The only problem is that we have a bigger lips. The Froggymouth size S are so narrow for leaving the lips in a really relaxed position. It's important, don't contract to strengthen the lips during the Froggymouth therapy. It's important that the lips are in a relaxed position, and sometimes even if the mouth is narrow, but the beaks are big, it's not enough space for keeping the lips in a relaxed position. That means that we had to go to the bigger one, the size M. That's the situation. Sometimes, even in children, the size is the smallest one. Anyway, sometimes we cover even the junction of the lips, but it's the only way. Anyway, the function doesn't stop.
Great. And speaking also about the little trigger and the little hints, when we are thinking about the very beginning of Froggymouth rehabilitation, what is the trigger point for you and the little hints that you are using to be able to identify these trigger points that these patients need to start a myofunctional therapy, need to become a Froggymouth patient? To summarize, what tells you when a patient enters in your office that this patient needs a Froggymouth?
When the patient use the lips for swallowing, just that. When the patient in the video, I ask to the patient, swallow, but drinking water, not trying to search, to looking for the saliva, swallow, and if the patient use the lips for the swallowing, the deglutition function. If the patient use the lips, that's the moment I continue to search all the situation, the anatomical situation of the tongue, the situation of the buccinators, the checks, the situation of the head. That's the meaning. The trigger point is the lips, are the lips.
Thank you. Thank you so much for all your answers. There is still a lot of questions in the chat that cannot be answered, but we are not having all the time for that. So for everybody that is watching us in replay and that is having any question, please feel free to comment with your question. And we're going to make sure to transfer this question to Dr. Rosero Martinez that will take the time to answer continuously also all the questions you might have. Dr. Rosero Martinez, once again, from the whole Froggymouth team, from the whole biotech dental family, we really would like to thank you for this beautiful and wonderful lecture. We are also so glad that this lecture will be able to be available in replays for the upcoming month or years. So for the ones that are watching us, I don't know when will you be watching us, but you can be sure that on Froggymouth website, you can find all the information about this lecture, the Froggymouth, and the future lecture about Froggymouth.
Thank you, everyone, for this opportunity. Thank you for being here. Thank you to Froggymouth family for really big opportunity to be here to share the wonderful way of my treatment changed my mind totally. And now, finally, I can say that relapse is just for the muscles and not for the fibers of the teeth. Thank you.